This is an incredibly difficult decision.
Harborview Medical Center's leadership says the hospital is simply too crowded.
We are now seeing impacts across the entire healthcare continuum.
Crowded enough for Harborview to divert certain patients to surrounding hospitals like Virginia Mason or Swedish for care.
I did meet with them this morning. They do have the capacity.
Harborview CEO says this is the last thing she wants to do.
We've reached a level at this point where we do not feel it is appropriate or safe to take in any more patients that don't require the unique, very skilled expertise of the providers and staff that we have in-house.
Harborview is licensed to look after 413 patients. Right now, they have 560.
And we are tired of, frankly, the word unprecedented.
And of that number, about 100 patients are ready to leave for post-acute care, like rehab or a nursing home. Problem is, those post-care facilities are dealing with staff shortages and can't take in more patients either. So Harborview is forced to only accept patients needing urgent trauma care or those with critical illness.
We agree that this is alarming.
The Washington State Hospital Association says Harborview is not alone. Hospitals nationwide are dealing with pandemic-related worker shortages and strains.
It illustrates the continued challenges of not being able to discharge patients who no longer have a medical need.
What are some of the solutions?
With any complex problem, the solutions, you need a multitude of them.
She says one of them is increasing long-term care capacity and providing better funding, something healthcare staff know is easier said than done.
This is definitely the most challenging time of the pandemic.
As for how this domino effect impacts us, patients may need to wait longer for certain care or even have surgeries delayed. Harborview says their patient diversion is temporary. They do expect it will go on at least through the weekend and possibly longer.